So, doctor, many people think that heart issues are only men-centric, but do women also go through these issues?
Actually, this is the biggest myth that heart disease only affect men. In reality, women also are prone to heart diseases. If you see data, almost 1 in 3 women die because of heart disease. So historically, the research and studies have always concentrated on men in their studies, but it is really a myth. Women also are affected, and we should not ignore, and we should give attention to their health.
So, what are the basic symptoms that you would say in women that they usually ignore?
So women, they always have atypical symptoms of heart disease. So chest pain is still the commonest symptom, complaint of heart disease in women, but shortness of breath, some fatigability, uneasiness, dizziness, back pain, and jaw pains. The women usually have such kind of symptoms which are usually ignored. So we need to keep high index of suspicion and evaluate such symptoms in women.
So would you say, like, a lot of cardio workout or, climbing steps, running, because these days women are into too many activities. Previously, they would just be, in 4 walls of the house. So how would you, compare, and how should I know about it?
So women, especially working women, if they complain undue shortness of breath in spite of doing mild exertion, climbing a floor of step, which they used to do previously. If they are not able to do those activities, then you need to suspicion. You should need to have suspicion of heart disease.
So would you say, is there any particular pulse rate or, uncomfortable feeling that is an SOS factor?
So usually heart rate for an adult, normal heart rate ranges from 60 beats per minute to 100 beats per minute. So if somebody is checking their heart rate, if it remains above 100, they have to be
cautious.
Yeah, cautious, and look for any heart disease or anything causing increased heart rate.
So what would you say is the first thing that I should do? Like if I know that there is some, uncomfort or breathlessness or something like that, what is the first thing that I should do?
So any undue symptoms, any shortness of breath, any uneasiness, any chest discomfort, having a new onset of symptom like that, you need to consult a doctor or a physician or a cardiologist as early as possible, because especially in women the symptoms are very atypical, they are non-classical. So like in men we have typical chest pain. Such typical chest pain is hardly seen in the woman. So women have to be careful. If any undue symptoms, such symptoms, they need to approach doctor as early as possible. And this is the reason why, because of atypical symptoms, they approach doctor or hospital late. And the disease is not detected, and then they land up into complications.
Can women in the 20s and 30s also have these kind of problems today?
Yeah, because there are various reasons, a lot of responsibilities in a woman, be it stress of work or job place, be it stress at home. There's a lot of they give priority to the family, kids, education and all. So there's a lot of emotional disturbance and a lot of stress they are undergoing. So that is one of the reasons the lifestyle has been different.
So previously women in 20s and 30s was not so common, would you say that?
Yeah. So if you compare to Western population, we Indians, they get into heart disease 10 years earlier than the Western population.
But is it also because of the food, the food style or the lifestyle? All these play a role?
Yeah, all these play a role. Especially if you ask me risk factors in women. So women, the lifespan of women is influenced by a lot of hormonal changes.
Yes.
So if you see the woman up to the age of 45, 50 till she attains menopause, she is protected uh, by the hormone called estrogen.
Okay.
So estrogen is a reproductive hormone in females. So estrogen protects her heart up to menopause. Once they cross the menopause, then the risk factor for heart disease in males and females is same.
Okay.
So incidence of heart disease is same. So women are more prone to heart diseases in the age of later
post
phase.
50.
Till then they are protected by estrogen.
Okay, so that means that they are placed in a better position compared to men. But
to men.
post 50, it becomes more dangerous, and they have to be more careful and agile of how their body is reacting to different.
The conventional risk factors, what we talk about, diabetes, high cholesterol levels, obesity. So these same risk factors apply to the woman. But the women who have these risk factors, they adversely affect the heart more than the men. If they have these risk factors, the effect on the heart is more compared
So
to.
like last time you had told about food eating habits, or lot of ghee, butter, and lot of heavy fat or red meat. These also are same thing with women. We have to digest it and run or get
We Indian women, they are fond of spicy
Sweets.
food and sweets. There are a lot of craving for masala food and oily food. So these such kind of food, they have a lot of salt in the food, lot of saturated fats. They are made up of saturated fats, lot of sugars they consume. So this is not good for the heart. So salt
in general also. I think
in
salt
general
is
also not good for the heart. Unknowingly we consume lot of salt in the form of pickles, papads, and so such things. So we should be careful and limit the salt intake.
What would 3 daily habits that you would recommend for a woman for a safe and healthy heart?
One is they should exercise regularly. Physical exertion is best to prevent them from obesity and
exercise, like any form of exercise, yoga, swimming.
Aerobic exercise and stretch exercises, yoga, swimming, walking, brisk
Pilates.
walking.
Walking, I think many women are into walking.
So walking is it's can be done easily. Can be done early morning or evening times. We need to have only pair of shoes. So it's easy to do. Brisk walking is important. So what is recommended is 150 minutes per week of moderate intensity exercise, or 75 to 80 minutes of rigorous exercise. That is for 3 to 4 days in a week is enough for a woman.
So even if women can plan alternate days, I think that's the best thing to.
They can do that. And walking also helps in mental as well as physical health. So it's good to, you need not spend more time going to gym and gadgets and all. Simple pair of shoes and then start walking. Involve your family, your friends, and walking, and do some warm-up exercises and some yoga along with walking. That is best.
That is one. Then what are the other two?
Other two are again the food habits to prevent obesity, and there are a lot of stress in the woman nowadays. Stress of family, their priorities are
family, and I think even because nowadays women are working, so working women also go through double stress.
So mental health is also important. There are a lot of emotional lability in women, so they are prone for depression and anxiety. So that causes adverse effect on heart. And so exercise, food habits, and stress.